Hello, everyone. Thank you for joining us today and welcome to our webinar on overcoming youth mental health challenges in rural areas. This is a session of our Let's Talk About Resilience conversation webinar series. And before we talk about this topic and jump in and have our panelists present, I just wanted to take a moment of silence and honor the lives that we lost yesterday and in that horrific event. So just take a moment to kind of recenter ourselves and really honor the lives that we lost yesterday. Thank you. So this webinar is being hosted by the New England MHTTC, or the New England Mental Health Technology Transfer Center. We are in part, so I'm part of C4 Innovations, and we are in partnership with the Yale Program for Recovery and Community Health, Harvard University Department of Psychiatry, and the Center for Educational Improvement on this grant. We are funded by SAMHSA, and this is a disclaimer basically saying that we are funded by SAMHSA, and the opinions and discussion today are of the opinions of presenters and facilitator and not of SAMHSA. And just some housekeeping information before I hand it off to Nate, who will be our facilitator for today. Participant microphones are muted at entry. You will be able to unmute during the discussion portion of the webinar later on. We will provide closed captioning. I'll turn that on in one moment. This webinar is being recorded and will be available on our website later today, and we'll be emailing everybody who registered with that link. Information about certificates of completion will also be shared in that email. And if you do have any questions during the webinar, or if you have any technical difficulties, please let us know in the chat. You can raise your hand, I can help you. And if you have any questions after the session, you can always email us at newengland@mhttcnetwork.org. The MHTTC network uses affirming and respectful and recovery-oriented language in all of our activities. And that language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, consistent with our actions, policies, and products. And I'll hand it off to Nate, who will be our facilitator today to introduce our panelists and our focus. Thank you.
Thank you so much. So today we have with us these amazing panelists who are experts in the field. We're going to start off with Miss Alicia Casey McCall, who works as a research associate for the Community Health Systems Development at Georgia Health and Policy Center. Next, we have Mr. Sean Perry, founder and president of We Are Hope. And last but not least, we have Ms. Shay Hawry, executive director of Comwell. And then today's focus is the challenges that we face, the innovation in the ways that we overcome, and the importance of social connection. And we are going to go ahead and get started today. So I want to start off with asking all of our panelists, what are some of the major problems that you have seen or heard from the youth in rural areas? Yes, Mr. Sean.
So I think one of the major struggles that we find in rural areas is access, right? Access to supports. Specifically up here in the state of Vermont and in the states of Vermont and New Hampshire, you are talking about anywhere from a 45-minute to an hour and a half, sometimes 2-hour ride to see a clinician. So having physical access is one of the major issues that people struggle with in these areas. And then to even have, if you were to do something virtual, to even have proper internet services that just don't allow for that to happen.
I would echo what Sean said. I think the access is I'm located in the Midwest in Illinois, and so we're surrounded by a lot of cornfields here. And so we actually have 3 office locations as a community mental health center, and access is definitely one of the issues in transportation, trying to get to our offices. That's one of the things that I think led us to really think or try to think differently about how we offer those services. So how do we break down and remove those barriers and those access issues? And one of the ways that we did that, which I think we'll go into a little bit more later, is really by trying to meet the clients where they're at rather than them trying to find us where we're at.
Yeah.
Along those same lines is the lack of providers, particularly for the grantees that we serve around the country with the Georgia Health Policy Center, is rural areas where there are fewer providers and there's just not the availability that we would like to see. So in addition to the lack of services, there's also the lack of the providers themselves. And another issue that I would bring up is stigma and the mindsets that the youth are dealing with when they are either trying to access services or if they are not certain about whether they should access services or what the response will be if they decide to voice their concerns about mental health.
Yeah, and I'd also like to add, when we're talking about access, you know, granted we're talking about physical normally, but we also have to talk about financial, right? And how do we change financial access for those who can't typically afford resources or don't have insurance or financial resources to do that. So, you know, we'll talk a little bit later about that, but I think we also need to keep that in mind, right? That access isn't just physical, it's also financial.
And I want to build too on something else Alicia said previously, and that is not only do we struggle with finding the staff whenever I think you're in a rural area like this, but it's also keeping the staff. It seems like oftentimes what we find is that we bring in staff, we train them, we get them licensed, and then they leave for other employers that can oftentimes pay more than we do. And I think as a community mental health center, that's one of our challenges, is really trying to be a generalist in many ways, but also trying to have specialties and really meet the needs of each individual person and the specialties and uniqueness that they bring to what they're needing from us.
I love that you bring that aspect of having providers leaving out, you know, because that can create this kind of shift when maybe a youth is getting connected with that provider and they're trusting that provider. So when they leave, is creating this, breaking this bond. So my next question, and I'll start with you, Shay, is how do you create that safe space for youths to come back if it's with a new provider?
Yeah, that's a great question. And I think that's one that we do struggle with as well. I think that creating that safety, trying to create that encouraging space that they feel comfortable and confident with the person that they're seeing. I'm going to respond and say that I think what we're trying to do more so too is to try to keep staff and really focus in on their happiness, their well-being, a lot of focus in on self-care, because the work that we do is really hard. So we work through a lot of compassion fatigue, vicarious trauma, secondary stress, things like that with our staff. So we don't necessarily have to work through that turnover. I would also say that we do try to work through a team environment. So it's not just necessarily one person who's seeing that client or that kiddo, that family, that there's more of a wrapped team that's around that family, those systems. So if one person leaves, hopefully it's not as detrimental and damaging to that kiddo, that we can still keep some safe space and transition that continuity with that family or kid.
I think for our organization, we're a little bit different in the sense that we see our students every day. So our students see their coaches, 5 days a week for a half an hour every day for roughly 60 to 90 days. So we are able to really build rapport rather quickly. We're not seeing a student once a week or even twice a week. Like I said, it's 5 times a week. And we also have built that relationship, or are also building relationships with their parents. Our coaches are constantly talking to the students, but also what's a little bit different about us, and I'm not sure if other people do this as well. A lot of organizations are a lot larger than ours. Is myself and James, who are the co-founders of this organization, we meet at some point every student that comes through the We Are Hope program. So in the event that we have to cover for one of our coaches that are sick, or a coach, ends up on maternity leave or something to that effect, they have someone that they know within the organization that is going to be there, that's met them. So we're able to kind of keep that flow going of safety with them and keep them, within the program.
That is amazing to hear, that they always have someone that they.
Nathaniel, I just lost your.
Yeah, we lost your audio, Nathaniel.
Do you believe that there is a difference between some barriers and challenges that might occur?
So Nathaniel, we lost your audio for a minute. So I just heard that one question. I'm not sure if you asked a question a little bit previous to that.
Yeah, I can restate it. I'm sorry about that.
That's okay.
So we've talked about some of the challenges that we've faced within this work. And we've also talked about some of the circumstances that might happen, providers leaving, getting sick. My question is there a difference between barriers and challenges?
Yeah, I believe, and I like that question. And we talked about that, pre-meeting here. I like that question because, there is a difference between barriers and challenges, right? So to me, barriers, or at least in my opinion, I should say, to me, barriers is something that is trying to prevent me, right? Something that's in my way, preventing me from accomplishing what it is that the organization's mission has set out to accomplish, right? Whether it's financial, whether it's community driven, right? So there are some communities that are still in the mindset of, we have no problem here. We're not talking about mental health. Every student in this school is fine. They just need, stricter rules and guidelines, which we all know is completely not true. So to me, those are the barriers, right? How do you break someone's mindset, break through someone's mindset? How do you, break through the financial challenges, so forth and so on? A financial barrier, sorry. But a challenge is just that day-to-day kind of obstacle, right? That comes up, that can be fun, right? That pushes us to do the work, or pushes us to do what we do, because we like to do it, if that makes sense. So, I love that challenge of the kiddo who comes into the office and says, no, I'm fine. And the next thing you know, 2 days later, it's like, oh, finally, they open up and the floodgates go and they're willing to talk. Or that family that was really struggling to get on board with the work that we're doing. And the next thing you know, mom and dad are calling you every single day, or grandma's calling you every day, like, oh, things look like they're going great here. What other skills can you teach me to be able to support my son or my daughter or my grandparents or my grandchild? So I think so challenges are these day-to-day little things to kind of work through, and barriers are these big, the way that I view them, these big obstacles that could really prevent you from doing the work that you may have no control over.
Well, during our pre-meeting, I had to chuckle because I said, well, I view these as kind of the same thing, barriers and challenges. I use them interchangeably. And then Sean's like, well, I don't. And he went on to explain that. And I was like, yeah, I think now I'm going to start not using them interchangeably, because I agree with those statements. So yes, barriers are these large, more encumbering things, and the challenges are more the many things that that we need to work through. But I'm going to say that I embrace both barriers and challenges, because to me, there's always opportunity whenever we see something like that to make change. So I appreciate anything that comes my way that I see as a barrier or a challenge, because that's always an opportunity to make things better. And I'll just also always, I'm going to throw this in. This is just a little nugget that I'm also always going to share. And when people bring barriers and challenges to me, I'm always so thankful for that, because like I said, I see that as something that we could always try to challenge ourselves in and do better with. Mm-hmm. So thank you for always, thank you for challenging me today, Sean.
Absolutely.
I think it's key to cue into those as being opportunities. And I think one of the things with a challenge in particular is it's a chance to invite people in and say, I need your help, or can you help me with? And it's a really great mindset to have, that this is an opportunity that we can take advantage of, rather than something that's going to stand in our way and stop us.
Mm-hmm. Yeah. Absolutely.
Yes, I think it is time for us, especially myself, because I know I don't do it now. We have to change our mindset. We have to put a focus on this. And thank you all for sharing that, because that's truly amazing. And so many providers now are going to be differentiating barriers and challenges because of Sean today. So that's amazing. And so with that being said, I know that some of you work within the schools and some of you work with the communities. So if you don't mind, can you describe some of the challenges or barriers that you faced with your work within either the community or school?
So we're actually, as a CMHC, again, we're in both. We primarily, I would have said probably 5 years ago, we're primarily in what I would call the community, meaning that we provided counseling services, case management, community support, and psychiatric care within our four walls. I think that, again, some barriers or some challenges that we began to identify as we were going through community assessments really challenge us to think, okay, is this really the best way to be able to reach these kiddos and families? And so we began very strategically to outreach into our school districts and to say, hey, we want to support you. How can we better help you? How can we better help our students and our families? And so we went from being in a school about 2 days a week, half time, 5 years ago, to now being in about 12 different schools with multiple counselors in each. And oftentimes more and more counselors more and more schools reaching out to us asking, hey, how can we get that? How can we have somebody embedded within our school district that's with Comwell that can see our students as well? And I think that it has brought a lot of recognition and awareness to what we do and to some of the issues that are being faced by the students. I would also say that some of the things that we thought might be problems we've already worked through, but we've also found additional concerns or issues or challenges, barriers, whatever you want to call them, that we still work through even 5 years later. So I'll stop there and let someone else respond.
Alicia, you want to go?
You can go ahead, Sean.
Okay. So I think for us, the biggest challenge that we faced was that we're a new organization. So when we started 6 years ago, people just didn't know who we were. And we created the modality that we use, right? So we took modalities that we knew that worked and we merged them. and we created a new modality out of that, right? So we took life coaching, we took cognitive behavioral therapy, and we used the cognitive behavioral therapy techniques, and we merged them into the life coaching model, and then we merged emotional CPR into that model, right? And we've come up with this amazing way to be able to support students. And people were like, well, what is this? We've never even heard of it. Like, you guys aren't clinicians. And I was like, I know, isn't that great? and they're like, well, wait a second. Well, what do you mean? And I said, listen, I believe clinicians do amazing work, right? There's a place for that. But our kids need consistency and support. And so we are that gap, that bridge between the clinician and support. And so what we do is being able to support 5 days a week for a half an hour every day for 60 to 90 days. So being able to pitch that was really our biggest challenge and barrier. And now the barrier is I think because we've been doing it for so long, I think now the barrier is just spreading the word, because again, we're new. It's just getting people to know that we exist. But I think that's the same thing for Shay, right? Is that they make, like she said, she's in she's in 12 schools, and now other schools are calling, but there's still a bunch of other schools that don't know that they offer it, right?
Mhm.
So it's all about getting that message out there that there are supports readily available for youth in all communities. Is the key.
And Sean, I'll go on to say too, we've been around for 45 years, and I will still be in the community and someone will go, where do you work? What?
Right.
I've never heard of them. And I'm like,
Well,
how do we do better on that?
Well,
Always.
what I've
It's always a
learned,
question.
what I've learned about that, and not to go off onto to a tangent on the side here, but what I've learned about that is nobody knows you until they need you.
I just said that to someone the other day. I'm like, until they need us, they don't need to know us.
Yeah.
And that's just the mindset. And then once they need us, then they're like, oh, I know where to go. I literally just said that. Yep. Agreed. 100%.
I think one of the important things that Sean brought up is the non-clinician. And that is something that can really address that barrier of provider availability and understanding the role that people in a child's village can play.
Mm-hmm.
So there are different interventions, evidence-based interventions that can be brought to bear in those types of scenarios where you want to equip the people who are already familiar to that group of children. You want to be able to give them tools to address the concerns that they see in their particular community. And that's a great opportunity to address that barrier of, well, we don't have, a person with these particular letters behind their name. Okay, so how do we use the people that we do have?
Right.
And I think this is a great time right now too, as we see our field shift to the value of peer supports, recovery coaches, people with lived experience. And I think that how to implement that within our organization was something that we struggled with. Like, okay, how does this fit? How do we supervise it? How do we monitor? How do we engage? There were so many questions that we had around that. And we were blessed that our state in Illinois embraced peer supports to the point that they put out grants and required it and gave us very good supervision and very good guidance in terms of how to make that implementation work. And we found more success and acceptance and reduction of stigma as a result of that involvement. And so that has been a great blessing to us as an organization, is just that lived experience, that I know what you're going through and I understand your path.
Absolutely. And that's a super valid point. And that's, at We Are Hope, we actually offer youth emotional CPR. And so I go in and I teach it as a class to currently right now in a couple of schools, 10th grade classes only. But in another school, we're actually turning that entire model into a peer support model so that the 10th grade supports the 6th grade, the 11th grade supports the 7th grade, and the 12th grade supports the 8th grade because it's a 7 through 12 school. And so now they're setting aside time every morning in their school for 2022-2023 school year, so that these kids can support and mentor, the olders can support and mentor, while the 9th grade gets the full curriculum. The other kids get the 2-hour intro, so that they at least have the language until they can start to take the full curriculum. So I agree that that's how we break that stigma and get it so that we can start having these students can start having these conversations and start reaching out for support when they actually need it. Absolutely.
I love that. That's great. Yeah.
So I love that you said that they can start reaching out when they need it. And I love that you all talked about they don't need you till they need you. They don't know you till they need you. One of the questions asked in the chat is, based on the rural landscape, how do you promote a valuable program to the community?
I think that's where partnerships are so important. Understanding that there are the agencies and organizations in your community that can be partnered with you, so that there's more awareness among any of those places where youth may be, where people may notice that youth have needs, or where youth may be bringing their needs and don't know about your particular project or program or organization, but someone else does because they've partnered with you, because you've been a part of efforts that they've had. And part of what I've talked with some of my grantees recently about is branding and marketing. Understanding that you are, in a sense, borrowing from advertising, and is there a particular color scheme? Is there a logo? Is there some way that your community can recognize you as being a source of assistance when it comes to mental health? Or if mental health or mental illness, you're concerned with that stigma, then maybe branding yourself in terms of wellness or mindfulness or whatever is helpful for your community. But having ways that you are putting your branding materials out there, so that when there's a local event, are you one of the sponsors, having your logo down at the bottom with the list of sponsors? Or is there something going on where you are going to be present and all of your people can wear t-shirts with your logo on it? Just different ways to constantly have those things in the public eye, so that people can become more aware of you and the services that you offer.
Absolutely. And I'm going to speak really quickly, and then I've got to hop off briefly, and then I'm going to try to hop right back on to get to this other piece. But one of the things that we do is we run a constant ad in both Vermont and New Hampshire, right? We have an ad running on Facebook, and it never stops. It's always pushed out. We also hosted the very first ever Youth Mental Health Gala, and we just promoted the heck out of that in the state of Vermont and New Hampshire, Connecticut, Massachusetts, and New York as well, just so that our surrounding New England towns could see that. And then we host the Upper Valley Youth Wellness Retreat again, where we put lots of ads out. So what I mean by that is people are constantly seeing us doing different things and events. We sponsor other random, I sponsor things for animal shelters, right? I mean, I'll sponsor just about, we sponsor a youth mental health ride. We sponsor a vets ride. We do lots of different things, like you said, Alicia, where our name is out there and people are constantly seeing it. And we're reaching out to our followers and asking them to share with their people as well. And I think that's one of the things that has been really helpful for us is getting that word out that we are here, and that's how you keep it going. I'm going to hop off really quickly. I'm going to hop into this other meeting, and then I'm going to try to hop right back in. Thank you all.
Thanks, Sean. So we went through a rebrand actually in 2020. We had been planning the rebrand for about a year and a half, and our launch was planned for July 2020. And it was at the height of COVID. So ribbon cuttings and big events and things like that we had to really rethink how we were going to do a rebrand launch in the height of the COVID pandemic. And so I can't express more than what you said, Alicia, about trying to make sure that people are aware of your logo, your branding colors, your name, what it's associated with. And our name Comwell came out of where community meets wellness. And part of that too is just continuously thinking about how to rebrand. What does that mean? How do we want to move? What do we want to move towards in the future? And I also want to highlight another point that you made that I think is incredibly important, and that is around the networking, because in small towns, there's just not a lot of us to go around. It's like all of us attending the same meetings. It's all of us trying to push the same initiatives and participating in each other's assessments. And, I say community assessments and strategic planning. And so we've really made a very focused and diligent effort on trying to make sure that we are not duplicating efforts, that we are sharing the community assessments, and that we work with our grantors to say, hey, we are doing a lot of work together to make sure that we're reducing duplication. As we do marketing, we try to share each other's brand. We try to promote the work that we do together, so we're not working in silos, that we're working our hospital works with our behavioral health care unit. Our behavioral health care unit works with the local jail. Our behavioral health is working with the school. And so we've tried to do beyond Facebook and also do like billboards within our community. We've also done what we call program spotlights, and we keep those updated. So it has pictures of our staff with their background, how to access those services. What does it look like once you get in the services? Where are those services provided? So it's just the who, what, when, where, why of each program that we offer. And we always keep them readily available. So whenever we go somewhere in the community or meet someone that wants to learn more about something specific to what we offer, we have that available. We've also done some very quick down and dirty kind of stuff, if you will, I'm trying to show this if you can see it. We do these little pocket cards that we can hand out to people, and it just has our branding on it. So if somebody is working specifically with a clinician in session on grounding techniques, they can take those little pocket cards with them to remind them how to carry out what the clinician just taught them in their own home or in the car whenever they're having a panic attack. Or we have other ones on relationships and how to, it's actually from the Gottman Institute, how to back out of a difficult relationship issue that you just got maybe cornered into. So lots on branding. I feel like that could be its own segment in and of itself, is the importance of branding, marketing, communication, awareness, networking, all those things.
And I want to also bring in a response to the question in the chat, particularly the part about the referrals and the relationships with other community organizations. One thing that's important is to gain a partner, you need to be a partner. So offering yourself to other organizations and agencies in your community, how can we help you? So that it's not always where others feel like, here they come again asking us for something, or here they come again wanting us to publicize their event, where you're really showing that you are there to help them as well. And that is also, I just was recently listening to a podcast that was talking about marketing techniques, and that is a marketing technique where when you offer something to someone, they feel an obligation to you. And if I could remember what that was called, but it's part of a way that you can start building those collaborations. If you're saying, if you're a new organization, we are here, this is what we do, but how can we help you do what you do? And looking for those connections. And I thought it was really great that Sean brought up the animal shelter. Mm-hmm. Looking in those places where you may not have thought originally. What are the opportunities in your community that exist? Do you have an animal shelter? Well, what does that have to do with youth and mental health? I don't know. You may be able to find what that is for your community or for your youth. is there really a connection between youth and being concerned about animals? Is there an environmental group that has the youth attention in your community where they're concerned about a natural resource around them, or combating the impact of something that is detrimental to the environment? Go find those organizations, looking around and seeing where you can make those connections. And it's okay if you are not able to point to, well, in the literature, it says this, that's fine, but it's in your community. And you're trying to create those partnerships wherever you can. And if there's someone who previously didn't know what you offer, then now you have people who know what you offer, and also taking advantage of those connections. One of the things that we had talked about previously with Shay was the benefit of small towns and those connections, because it's my next door neighbor's cousin who can help you with that. I can just call them. Or what about somebody's son-in-law's brother? Just looking around and seeing who is there and where they can help you make those connections, where you can help other people make those connections. That's really one of the benefits of the rural areas, is being able to get closer. Instead of 6 degrees of separation, there might only be 2. So you can find what's there and get things done and build those partnerships and connections a little easier sometimes.
Absolutely. And I would say it's also to, just to expand on one word, I'm going to say one word that describes too, I think, what you're saying, and that is value. What value we bring to our partners and to our networks. And, there's so many different ways that we can provide value as individuals who serve youth, and we serve adults as well. And we serve mental health, substance use, developmental disabilities. So how is it that we can partner either as a potential and as a agency who can bring individuals who need employment and could be that rock star worker for you that you've been wanting, who as we can help assist in your emergency departments with de-escalating the behavioral health patient as you're trying to work with an individual who's having a heart attack. We've done a lot of work in terms of trying to talk about providing, we do a lot of talks in the community. How can we provide training on de-escalation? How can we provide training on what are mental health signs and symptoms? What do you look for whenever somebody is using drugs or alcohol and they're falling asleep in your class? What does that look like? What are their pupil sizes? What are their mannerisms? What are their words sound like? And so I could digress, but yes, what value can we bring to your organization that we can help make you stronger and better as well?
And I also wanted to address the other part of that question about the staff shortages and how that's impacted the services that are provided. I think that is another key area where partnerships can be so important, because if there are closures within the community, like agencies close or staff moves from that community to somewhere else, being aware of what else in your community can help fill in those gaps. So like Shay mentioned earlier, like your community needs assessment, where you've identified where some of those gaps are. When you look at your SWOT analysis and you are able to identify different strengths and places, that's where you can look to fill in where you have those shortages as a stopgap until you're able to fill the position, or if there's another way that you can meet that need. Is there a way that you can tap into non-clinicians to help with different needs that are brought up by those in your community as well?
And I would echo exactly what you just said. The staff shortages for us were really just incredibly damaging there for about a year. It felt like we just could not find anyone. I'm talking about a third of our workforce was just non-existent. We would run ads, we would try to recruit, and there was just no one. And so I think it forced us to really rethink, how do we deliver services? So, we looked at providing additional groups. We looked at how do we look at more community support? How do we look at more peer services that can be that outreach and that arm when we don't have licensed clinicians or those master's level clinicians. And it was a true blessing. Again, you look at those barriers and those challenges, and they force you sometimes to look at those ways that you need to do better to be better. And that's one of the ways that I think it helped us grow by forcing us into a really uncomfortable place with that staff shortage. So I also see Vanessa's question in the chat about talking about social connections. Have you found them to be effective in overcoming any red tape and establishing any programs in your community? Alicia, did you want to respond to that, or do you want me to go first?
Go ahead.
So, as I'm reading that, to be effective in overcoming any red tape and establishing programs in our community, I think some of the red tape we always face is around probably the financial barriers. How are we going to deliver the services in a way that aren't going to lose money? As a not-for-profit, we're still not for loss either. And so how do we really work through and identify how we can deliver something that's going to be effective? And I think, again, we do that with our partners. I think we look at where is the most cost-effective place to deliver that service. Is it us? Is it not us? Is it our local primary care physician's office? Is it, the school district? Is it whom? Just where? And so I think that we've, like I said, really tried to step outside of our comfort zone and move services out of our offices and into the community. So we've developed relationships with our housing authority as well. So we have a community support worker that's embedded within our local housing authority to decrease, again, access and barriers to services. So that way, all they have to do is go see their local familiar face in their housing office. And when they share what their struggle is, whether that's food, clothing, shelter, emotional challenges, parenting challenges, just life skills, activities of daily living, that person is skilled and knowledgeable in the direction that they can send that person to get the help and resources that they need. So I think it's always trying to identify what is the red tape and just how do we break down the barrier and how do we address the challenge and make it to where it's just a challenge. It's like, okay, how are we going to do this together? And you bring in your partners, you bring in those 2 degrees of separation that from your local community, and you say, this is a problem. How are we going to fix it together? Because it's not my problem. It's not your problem. It's our problem. And it is our community. And I think as long as we continue to look at it like that, like this is our shared community, these are our future adults that we're working for and with, in the kiddos that we serve, how do we help raise them in the most healthy way as a village?
And I was just at a conference last week with someone who brought up how they're in a rural area and they know their mayor by, like, we go to the same church, they were a Bible study group. So it's important to appreciate that we may not have as many barriers as we think we do. When you make those connections with people in your community and understanding, well, if we want to get this done, then we're going to have to go to the city. And then, well, when we go to, who do we talk to? Well, what office is it? Oh, I'll just call up the mayor and ask. Mm-hmm. Like, there are people that you know who know people. And those connections are so amazing, and they can really, really tap into places that you may not know that are just that close to you. Just reaching out and asking and making it known, what are those needs that you have, or what are you trying to accomplish? And to the point of offering yourself, being a partner to others, also serving in that role of letting others know who you know and building your networks that way, not just in a personal for you professionally, but for your organization. Because one thing that's important that we don't want to have happen is have that one person who knows how to do it and nobody else does. So if that person retires or moves away or gets a new position, then, well, we don't know because they were the only person who knew everything. So you really want to, like the point Shay was making earlier about having people be generalists, sharing the knowledge and being sure that everyone is able to take advantage of the wealth of information that is available, the connections that are around, and understanding how they can reach out and access the different people in the community who can help make a difference.
And I would say the downside of sometimes knowing everybody on the flip side of that is when you have to have really difficult conversations about different viewpoints. And that can be really challenging too, because you do know those people and sometimes they're your friend, but they're also the person that you have to do business with, and being able to separate kind of that personal and professional relationship and talk through that is incredibly important, and a skill that I suggest to everyone work on and learn. I know one of my favorite books, I don't know if I can say a favorite book, it's Crucial Conversations. And I found it to be incredibly valuable as I have to have difficult discussions sometimes with sometimes what are my friends and my colleagues, and being able to say, hey, we got to talk about this hard thing where we have a difference of opinion. And we may not walk out of this conversation seeing eye to eye, but we have to be able to walk out and still be friends too. So how do we do that? And that's also just part of small town living.
I think one of the things that we can do with those connections is, if there are situations like that, there can also be opportunities to connect people to where they may be better suited. Mm-hmm. So this is not working, but I think your interests align with XYZ organization, or have you thought about this? And because you have those additional connections, it can help ease that. It won't make it completely comfortable, but it may be a way to make it not sting as much, because you can make a connection to somewhere else.
Yeah. So there's another question in the chat about how do you close the connections between community members, impact youth seeking help. In other words, do you feel comfortable accessing mental health services knowing that others may know? Oh, I just lost it.
Knowing
that others may find out. Yeah,
Mm-hmm.
There we go. Yeah. So Sean, since you're back and Alicia and I have been doing all the talking, do you want to take that one?
Thanks for taking it up and covering for me, guys. I appreciate it. And I apologize.
I don't think we let Nathaniel raise a question to us. We just kept talking. We just made up our own questions as we went.
Yeah. So how do close connections between community members impact youth seeking help? So let's start there. I will say that I'll give you a really great, for instance, I got a call the other day. And we see a student, the principal called me to come see a student, because I don't see kids anymore because the company's too big and I'm doing other things. I mean, I have a couple of private clients, but and he said, hey, can you come see this kiddo? I think you'd be a really great fit, and he needs somebody like you to work with him. And it just so happens it was the school secretary's son. Mm. Right. So how to close connections between community members? I think that really all depends on the service provider. And what I mean by that is, if you have good service providers that remind that child and other community members that it's not about them, it's about the support for that young person, then you can kind of work through whatever challenges may come up. Now, there's always a little bit of shame that we all face, I think, when asking for support. But that can be shifted by a good service provider allowing that individual to know that it's about them, right? And walking them through that process, and not about the thoughts of other people. But that's also about building capacity in the community around how important supports are.
And I think for the second part of that question about feeling comfortable accessing services, knowing that others may find out, I think part of what we are doing when we're working to decrease stigma is address that very thing. Mm-hmm. And it may be an issue of reframing, and that's when we are really cognizant of the language that we use and how we are helping when we're in an area of helping, really being cognizant of how we are presenting information. And it's not that there's maybe it's not, maybe you should go see a psychologist. Maybe it's, how I'd like you to talk to my friend Karen. Karen's a psychologist, but that's not how you're bringing her up. You're saying, this is my friend who has, who may be able to help you process this. Or if you want to discuss how you're feeling about something or the impact of something, maybe it can be as simple as reframing how it's presented, because there's a difference between presenting something to someone on a trash can lid in their perception or presenting it on, fine china. So really being cognizant of how they may perceive the services that are available and how they may receive the message that you're giving.
Yeah, but I agree 100%. But I also think that it's how the first contact, if you will, right, is seen, right? So a great, for instance, is in our buildings now, we actually have students that request to come see us because their peer, right, is working with us and they're seeing the change or the support that they're getting, and they want that also for themselves. So I think it's that first contact that really makes a big difference. That provider who's there supporting that individual and that rapport that they built is going to be the beginning, the middle, and the end of whether or not any other work is going to get done with anybody else, and how easy of access that's going to be for other people to access emotionally.
And I would agree with all that. I started actually as a youth substance use clinician in an at-risk school. And at first, when I was first brought into the school district, for example, it was a challenge because there was a lot of trust issues there that I had to work through. I had to demonstrate, and honestly, time was probably one of the only things that could give me my credibility, was the fact that I didn't share the information that they shared with me. And by the time that I left that school, I didn't even have to necessarily have any referral sources because the kids themselves brought me the referrals.
Right.
They would bring their friend in and go, hey, you can trust her. She can help you. And to this day, 15, 20 years later, I still have some of those same kids reach out to me and go, hey, I remember when you said, and I'm thinking, oh my gosh, what did I say 20 years ago? And I panicked for a second. And then, luckily I must have had some wits about me even back then, because I'm like, oh, yeah, that's still true to this day. Absolutely. And that tells me that even if I didn't think that they heard me at the time, I was still planting those seeds. And to this day, some of those seeds are still sprouting and growing.
Yeah.
And I'm very thankful for that impact I was able to share 15, 20 years ago.
That is so amazing. So I see that we only have a few minutes. So I want to open up the question to all of our panelists. A quick 30-second advice you have for someone who are starting out, or that someone who has hit a barrier or a challenge that they are facing.
Starting out in this field?
Yes.
Oh, that's a good one.
So I thought a lot about this one. Sean, are you going to take it, or you want to think about it?
You go ahead and then I will go. I
would say get a good internship. One, that you're able to be exposed to lots of different populations, diagnoses, environments, because what you think when you're coming out of school, what you think you're going to like and what you think you want to work with can be two very different things. So when interns do come through our organization, we try to let them see our community day service program with individuals who have intellectual and developmental disabilities and work with them. We let them go into the schools and see what it's like to work with youth, teenagers, itty bitties, and then also having that opportunity to work inside the jail and see some substance use counseling that occurs with adults who are involved, criminally justice involved. So you can walk out of school thinking you like one thing, be exposed to those populations, those sessions, those people, those personalities, and find something completely different. My second thing I would say is understand you're going to do a lot of documentation. No matter what you think, you're going to do a lot of paperwork. So don't let anybody tell you you're not. That's my two things.
All right. So all those things are true, Shay. The one I've got a couple of things. So first, I think it's very important to anyone listening to this call or who watches this video down the road, if it's posted somewhere, to remember that you don't need a degree to be a human being. You don't. You don't need a degree to love another human being. If you want to do your best work in this field, be your authentic self. If you do that, you will be a phenomenal therapist, clinician, coach, but most importantly, a human. And that is what this work is all about. You know, yes, there's tons of documentation. We do documentation in our work, and there's all these different sects of learning, you know, all these different modalities and this and that, and all those things are important. But if you come there thinking about you rather than being a good human and realizing that your main job is to love another human being to support them, then you're doing it all for all the wrong reasons. That is the key.
Okay, scratch everything I said and just listen to Sean. That's gonna be my next, that's my next feedback, okay? Just scratch what I said.
I would say, particularly for someone getting started in the rural context, is that you don't have to start from scratch. There are opportunities to look at what's been done in other areas. There are people who have tread this path before you. You may be a trailblazer in your specific community, but there are others who have worked with the similar barriers, who have worked with similar contexts. And you can find the either organizations, like national organizations, or doing some research and finding out other educational sources or other programs that have been done that you can pull from. Just like Sean mentioned earlier, how they were able to create something new by pulling from what exists. And so I think that is so important. It can feel discouraging sometimes when you're at the start, but you don't have to reinvent the wheel. There are resources out there, there are places that you can pull from to help you to get started.
Absolutely.
I just want to say thank you to all of our panelists for joining us today. You guys were amazing, shared so much knowledge with us today. I'm going to turn it over to Vanessa to close us out for today.
Yes, thank you so much to all of our panelists and to Nate. I just want to share a few bits of information before you leave today. Just pulling up my slides, please bear with me. And let me share my screen very quickly. So I just wanted to bring to your attention, if you could please take a moment to fill out our evaluation. I'm going to be posting the link in the chat. It's very important for us to continue to provide trainings such as these if we have your input. So let me just put that in the chat very quickly for you. And you can also find us and follow us on social media. You can find us on Twitter, Facebook, LinkedIn, and our website is listed here as well. And then just a little bit of information on our website. There's a lot of information here, but I just wanted to point you to our newsletter. You can sign up for a newsletter here on our website, and then you can register for upcoming events and find recordings of our products, of our previous events that we've hosted. And here are some of the upcoming webinars that we have. They're really, really interesting, great information. It'd be great to have you register and be there with us. And again, I just wanted to take the time and thank you, all of our panelists, for joining us today on this important conversation, and to our participants who were so engaging in the chat, asking questions. Thank you, everyone.
Bye, everyone.
Thank you. Take care.